and quite frankly, as we get closer to the peak, whenever that peak will be, either sometime in later this month or the early part of May, whenever it comes, we do expect the numbers to continue to go up. So we had 175, as you know, yesterday we reported 402, but that was because of the backlog that went back as far as mid-March. The number of deaths has increased by 1. And so yesterday we were at 10. The number, we're adding 1 more death to that list. That brings the city of Houston's total to 11. And to put that in some context, I believe now we are close to 11,000 that are dead across the United States. Of that nearly 11,000, or whatever the number is right up today, let's say 11,000, the city of Houston accounts council members for 11 of that number. And then closer to home, the Chief of Staff of Councilmember Tiffany Thomas, her father, the Chief of Staff father passed away in Louisiana. And so we certainly want to extend our prayers and condolences to the Chief of Staff of Councilmember Tiffany Thomas. In fact, we just got that text a few minutes ago. The person who represents our 11th death, unfortunately, in the city of Houston, was a young man. He died in his 30s with underlying health conditions. So this was a person in his 30s with underlying medical conditions, and he passed away on April the 1st of this year. So again, that brings our number of people who have died as a result of COVID-19 inside the city of Houston to 11. And the number of new cases that we're adding today is 175, which brings the total count to 1,320. We certainly know that there are more cases out there, and the testing has not been as robust as we would have liked it. Our goal continues to be to blunt the progression of the coronavirus and prevent an overwhelming demand on our healthcare system. And we are accomplishing that based on the data that we are reviewing. So whether you look at the number of ventilators that are available, those that have been used, the number of IC beds that are being utilized, the number that exist, the general admission beds in our hospitals, we are still within our hospital, the healthcare delivery system ability to care for those patients that are needed to be attended to. That's the goal. That's the goal, is to stay within their ability to provide the care to each, even more so in the month of March, to continue to wear your face coverings, even if you're asymptomatic, to stay home, to be mindful of when you're away from your homes and the grocery stores, to engage in social distancing, laundromats, you name it, when you're in the parks, all of that. But this is a very important month across the country, but especially for those of us in the city of Houston, this is a very important month because in a few days, Passover is starting. And then at the same time, this is the Good Friday and Easter Sunday coming up, the weekend. So for those, this is a very important month. So please be mindful of the fact that social distancing, whether you're at home or in the park or in the grocery store, is still needed. I do want to say something because we're now into 4-digit sort of numbers. Yesterday when we reported 1,145 cases. I do want to kind of give a little bit more information on that. Of the 1,145 cases we reported yesterday, in that number, 146 of those were people who were hospitalized. So we reported 1,145 cases of those people who had tested positively for COVID-19. But only 146 persons were hospitalized as of yesterday in that total number. So again, just trying to drill down a little bit more to kind of provide you with a little bit more information on the numbers that we are providing to you. So we know things are working. The overwhelming majority of people self-isolating and self-isolating at home and recovering at home. And a new report from the Kinder Institute shows additional positive news. This is the Kinder Institute at Rice University. Based on their study, estimates show that the Stay Home, Work Safe order in the city of Houston and Harris County are preventing deaths and hospitalizations. The estimates show that social distancing measures during the 14-day period between March 24th, when the order was issued, and April the 6th, have saved the lives, in their report, in their study, 4,533 Houstonians, and kept another 48,812 from being hospitalized locally. That's from the Kinder Institute and their study. The report goes on to say that if we continue this path, by April 22nd, we could save 13,220 lives right here in the Houston-Harris County area. So the message is very, very clear. Social distancing works, and April is a critical month, and we cannot get complacent. Let me also provide some other good news. As you know, over the weekend, we got word that our federal health partners would be pulling out by April the 10th. And that also would impact the PPEs provided by the federal government. Just got confirmation today that they are not going to pull out, that they will continue to remain in the city of Houston through April the 30th. And there were 3 persons at each one of our testing sites, 6 in total. But what is more important is that the PPEs will continue to come, and that the federal government will continue to assume 100% of the cost. So it won't be a cost share 75-25. So just got confirmation on that, that the federal healthcare workers will continue. The PPEs for the testing sites in the city of Houston will continue, and the federal government will continue to assume 100% of the cost. And I want to give special credit and acknowledgement to our congressional delegation. I want to thank them. They were very, very active in advocating on behalf of the city of Houston. So let me give a special acknowledgement to our congressional delegation. Let me thank Chief Art Acevedo as well. I know he was active on the phone, working his connections also in DC. Want to thank him. Want to thank Dr. Purse and Director Williams and the health department for their work in making this happen. And so that is good news. And I think that's an excellent way to segue away to Dr. Purse.
So that's going to help us with our testing and maintain that capacity for folks that want to get tested. A couple of other things I want to point out that the mayor touched on is that the social distancing works. We had a graphic here yesterday that showed the impact that one person, by just reducing the number of folks a day, could potentially infect. Remember, the phenomenon of asymptomatic or pre-symptomatic spread, which is unique to this virus, is real. That's why so many of us are wearing masks, so we don't accidentally spread it. But if one person were to infect 2.5 people, which is the estimate of what one person would routinely infect without social distancing, that within a month that comes to just over 400 people would be infected. If they were to cut it in half, from 2.5 people to 1.25 people, it drops down to about 30. Okay, that's greater than a factor of 10 reduction. So social distancing is incredibly important. That having been said, because you're wearing a mask does not mean you don't have to social distance. The social distancing and the mask are 2 different strategies or 2 different techniques. They work with each other, but one absolutely does not replace the other. So we have to do both. And the third thing I wanted to remind folks is that with testing, it is a test to see if you happen to be infected on that day. I continue, even though we've talked about it many times, I continue to hear people say, I need to get tested so that I won't get the virus. That is wrong. It is not a vaccine. If you get tested and you're negative that day, and we're seeing people aren't getting the results for 4 or 5 days, sometimes even more, you're going to become infected again. This is why it's good, it's important that people understand the function of testing. So social distancing, wearing the masks, testing, 3 different strategies, all aimed at the same goal, but no one replaces the other. Thank you, sir.
Let me announce as Mayor Pro Tem Dave Morgan, Vice Mayor Pro Tem Martha Castack Tatum, and Council Member Edward Pollard. So I want to thank all of them and the entire city council members because they have just been very supportive. This is a team effort, and I want to thank them for all that they have been doing and continue to do. I also want to thank Flowtech Industries for donating 1,240 gallons of hand sanitizer, 191 gallon bottles with pumps, 210 5-gallon bottles with spigots, and an estimated value of $43,000. And this donation to the city was done in partnership with Tudor, Pickering, Holt and Company through Flowtech Energetic Foundation. And we have representatives here today, including no favoritism at all, but this is a good time to remind everyone that the City of Houston, the Astro Foundation, Cheniere Energy, and Project Cure are hosting a PPE donation drive tomorrow from noon to 3 at Minute Maid Park. And I want to say to Flowtech before they move to the side, this is what Houston is all about. We have some fantastic partners, people who are stepping up each and every day and providing essential supplies for our first responders and healthcare providers. And quite frankly, the City of Houston could not afford to do it just on its own. So let me thank you all again. I'm very blessed. Thank you. Thanks, John. And so bear in mind that the supply drive, the PPE supply drive is tomorrow from 12 to 3 at Minute Maid. And we are asking for new, unopened, including N95 masks, surgical masks, face shields, gloves, surgical and isolation gowns, protective coveralls and shoe covers, and hand sanitizers containing 70% alcohol. And the city will distribute all donated items to personnel at the COVID-19 mobile testing sites and to first responders and essential municipal personnel operating the Houston Parks Department, the Meals Distribution Centers, and the Mayor's Office of Homeless Initiative. So I want to thank you all for that. And then I also again want to remind you about Thursday at noon, wherever you are, just pause for a moment of prayer, silent meditation, whatever you want to do. And it's totally interdenominational, so it's not just based on any one faith. Passover starts this week as well. So wherever you are, at noon, wherever you are, just pause and for a moment of silent prayer meditation. Now, having said that, let me pause. Chief Kenya, any additional report today?
Sure.